All right, it's preparing. And I have this set up so I can.
It says we're now streaming. But I don't see it.
All right, it's preparing.
Oh, okay.
And I have this set up so I can.
It says we're now streaming. But I don't see it.
All right, it's preparing.
Oh, okay, so I'm hearing myself feedback.
And I have this set up so okay. I'll start sharing the link around.
Maybe we should shut our video down now.
I'll start sharing the link around.
Can you put the link in the comments? Maybe we should shut our video down now.
I'll start sharing the link around.
Can you put the link in the comments? Maybe we should shut our video down now.
I'll start sharing the link around.
Can you
Okay, am I on? Let's see.
John, you're on and we can hear you.
Oh, that's good, because I don't know if you could.
Thank you.
Oh, you're welcome. Hey, Jen. Haven't seen you in a while. Hey, Sheriff.
Hi, John. How are you?
I'm great. Yourself?
Good. Good to see you.
Good. Am I supposed to leave it on mute until I'm ready to talk, or how does this work?
That's probably a good idea. Everybody can leave themselves on mute until they're ready to talk. And that'll decrease feedback going into the broadcast. So that's always good practice.
Okay. This is like my second time I did Zoom, and so it's all new to me.
You're doing fine.
Okay, let me do it then.
Tina, whenever you want to start. And if anyone has any problems, you can use the chat to reach Amber or I, or just we'll be here.
I think we should wait. I see not 10 participants. Maybe we'll wait another minute.
Yeah, whenever you're ready, you guys take it away.
Okay, it's 1 o'clock. I'd like to start this meeting of the New York State Police Reform and Reinvention Collaborative. And I'd like to thank you all for joining us and for volunteering for this committee. For those of you that don't know who I am, my name is Tina Mollet. I am the chairman of the Board of Supervisors. And what I'd like to do is give you a little information about myself. And then for the rest of you, I'd like to go around. I'll call your name and please introduce yourself. I know there were a lot of us that were here at the last meeting, but there are some new members. I have been a supervisor for the town of Bovina. This is my 20th year. I have been the chairman of the Board of Supervisors. I am finishing my 4th year. I'm not going to pretend to know a lot about drug addiction, about police policies, mental health. But what I have done over the 20 years, my experience has been, I sat on Cindy Heaney's Community Services Board for mental health for several years. I sat on the Delaware Opportunities Board of Directors for about 16 years. And various other county committees over my tenure. So I'll go around and we can introduce ourselves, and then I will express what my expectations are for this this collaborative and what I think that we can learn from this and come out with for the community. So I'd like to go around. I see Bud Gladstone is on. Bud, if you would like to introduce yourself and give us some history.
All right, I'm Bud Gladstone. I'm Andy's town supervisor. I've been supervisor for 6 years. I'm also on the Delaware Opportunities Board. I'm also on the WAC board and actually moving up to the chair of the WAC board tomorrow. And my part-time for a living job is I own quite a large beef operation in Andy. And I'm also a chair of the Public Safety Committee.
Great, thank you. Sheriff Dumont?
Can you hear me okay?
Yes, thank you.
Oh, okay, hi. I'm Sheriff Craig Dumont. I've been here as sheriff for the last 3 years. Prior to that, I was under sheriff for a number of years, but I have a total of 35 years in law enforcement. I've dedicated my life to public service and to law enforcement, and I take my job as sheriff very, very seriously. It's something that I never shut off. It's 24 hours a day, 7 days a week. I've held about every position there is between line police officer and administrator as the sheriff as I am today. Been a member of a number of different leadership development programs and courses. And I'm not going to bore everyone with the details, but two of them I'm very proud of is the Governor's Office of Employee Relations. I graduated from that course. As well as the National Sheriff's Institute out in Aurora, Colorado. And prior to becoming sheriff, I was accepted to the 272nd session of the National FBI Academy, which I graciously turned down when I was elected sheriff. So, you know, I continue to not be stable. I'm always looking at new ways to improve. I think that this committee and this collaboration is an excellent way of doing that. Very proud of our New York State accreditation program that we have here. There was an article in the paper last week that had some mistakes in it in regard to who actually accredits us. It said that the New York State Sheriff's Association does, and it's incorrect. It's the New York State Accreditation Council. That council is made up as a state agency with the governor's appointed council members. And we are looked at on a regular basis here at the sheriff's office. This is why I'm not afraid of having this review done and having people look under the hood, because I'm used to it. You know, once a year we have a review by our accreditation council, and every 5 years we have an actual physical reaccreditation audit. It's an in-depth review of all our policies and procedures by independent auditors approved by the accreditation council. They're here every 5 years, not only making sure that we have the appropriate model policies and training practices in place, but that we actually practice them as well. And they spend an immense amount of time making sure that we are upheld to those standards. Again, I think this is going to be a wonderful thing. I'm always looking for new ideas. It's how I lead my agency. I'm not a dictatorial type person. I actually an empowerment model is what I use. And you can ask any employee that's ever worked for me, and they'll tell you that I push power down. I give ability to those who have the opportunity to make changes in an organization, to make those, and give them the resources and tools they need to make them. So, you know, I'm very, very happy to get new ideas and to foster relationships, because I think that's the number one goal of the sheriff's office. In regard to, there was one thing before I relinquish my time that I want to say. There's been a number of misconceptions in regard to what this plan encompasses. What I mean by that, as far as which agencies that it encompasses. Just this last weekend, I received a number of messages from folks that said, "Oh, I can't wait until, you know, police agency X has to comply with the plan that Delaware County is coming up with." And as many times as we put this out and tried to clarify this, the plan that Delaware County is coming up with just pertains to the sheriff's office. All right. So the other local agencies here in Delaware County, whether it be, you know, Walton PD, Sydney PD, Delhi Police Department, you know, they are all subject to their own plans created by their own municipalities. And I think that needs to be made clear, because there just seems to be this recurring misconception that Delaware County is setting the standard for all police agencies in Delaware County, and that's not the truth. We certainly don't set them for the state police, who are exempted by this executive order. So with that being said, I welcome everyone, and I look forward to working with everyone as we move this forward. Thank you.
Thank you, Craig. One thing I'd also like to clarify, I know that I have received several emails. This is not about the Delaware County Jail. This is about the Sheriff's Office, correct?
Correct. The jail operations has nothing to do with Executive Order 203. It has to do with law enforcement agencies, police agencies. And so what we're looking at is the overall operations of our law enforcement division. Although I will say that, being a firm believer in law enforcement accreditation, I have moved forward, and it was a goal of mine when I was elected sheriff to accredit both the civil division and the jail division. And it's a very time-consuming and lengthy process to get an agency ready for accreditation. And I can happily report that we just passed our civil division accreditation a couple of weeks ago, and we'll be receiving that certificate next month. And the jail is ready to be accredited. A matter of fact, we were supposed to have our first accreditation audit for jail operations last week. And unfortunately, due to COVID, that's been postponed until January. And so we're hoping to get those auditors rescheduled for the month of January. But yes, short answer, Tina, this is just on the law enforcement operations.
Great, thank you. Next, I'd like to introduce John Grenier.
Okay, I think I'm good.
Yes, I can hear you. I think we can.
Okay, yeah, I'm Pastor John Grenier. I pastor the Oneonta, Assembly of God Church in Oneonta, New York, right on the Delaware-Otsego County line. I am also the head chaplain at the Delaware County Correctional Facility. I've been there now for since 2005, so it's been 15 years. Headed up the church services there, as well as any way to inform inmates of either death or just different tragedies that have happened in their family. I'm able to counsel them one-on-one, but also have done in the years past the Angel Tree Project, which provided gifts for children of inmates' kids. And this year, because of the COVID thing, we could not do that. But we still reach out to the inmates' children as best we can. I look forward to being a part of this committee, and truly I do believe in the agency and what it's doing in Delhi, working with the Sheriff's Department under now 2 sheriffs. And it's under Mills and then now under Dumont. And I look forward to this discussion. Yeah, I hope that's enough information for you.
Great, thank you very much. We're happy for you to participate. Next, I'd like to introduce Cindy Heaney.
Hello there. I'm the director, Cindy Heaney. I'm the director of community services, which means that I oversee all disability services in the county, and that includes all mental health programming, all substance abuse program, as well as developmental disabilities. I have been in this position for 10 years, but most of my career I've spent in the world of addiction. I'm looking forward to creative solutions as we continue on to have serious mental health concerns in this county, as well as substance use issues. So I'm here to learn and listen. Thank you.
Thank you, Cindy. Next is our public defender, Joseph Ormetti.
Hello, I'm Joe Ormetti. I'm the public defender for Delaware County. I started off my college career at the Rochester Institute of Technology in the criminal justice program, transferred to Siena College and graduated with a degree in political science, and then went ahead and graduated from Albany Law School. I've been practicing criminal defense work for 29 years, so I'm fairly acquainted with all the subject matter. I sit on the treatment court here in Delaware County that helps drug and alcohol addicted people try to make their way through the criminal justice process, and a number of other criminal defense related institutions that we have in New York State.
Great, thank you. Next is Mary Rosenthal.
There we go. I'm Mary Rosenthal. I'm the director of the Alcohol and Drug Abuse Council of Delaware County. We're an information, prevention, and resource agency. We're a nonprofit organization, and I have been employed there for 25 years.
Great, thank you. Next, Jen Cutting. I didn't have the chance to meet you at the last meeting, and I look forward to getting to know you. Thank you for volunteering.
My pleasure. Thank you for having me. So to start off, I am a woman in long-term recovery who has navigated many of the issues that we're going to discuss today. I have navigated mental health in Delaware County. I have gone through substance use disorder programs that we have in the county, as well as the jail, and I've also lived in the shelter. So I have been a part of all of the programs on a personal level. I am now fortunate enough to be a CARC and a SERPA, which means I am able to help people on their pathways to recovery as far as coaching them, and as well as being an advocate for them in court and through other various agencies when they need help. I'm very grateful to be here today because this is a very, very near and dear topic to my heart, and I'm very passionate about it. And I look forward to collaborating with all of you and truly making a change in our community. So thank you for having me.
Thank you. Next for introduction is our probation director, Scott Glucker.
Good afternoon. My name is Scott Glucker. I am the probation director. I started working for Delaware County in 1996. I became probation director in 2008. I recently ended my term as the New York State president of the New York State Council of Probation Administrators, where I'm now the immediate past president, and I'm active in the American Probation and Parole Association. Looking forward to hopefully contributing to this and being part of the dialogue and trying to find some solutions.
Great, thank you. Next, I'd like to introduce Joyce St. George. Joyce, I've had the pleasure of speaking with you, but now I can finally put a name with a face. So welcome. I can't hear you. We're not able to hear her. Okay, I'll come back to her. Okay, Jessica Farrell, I think I have met you at one time. Thank you for participating. Would you like to introduce yourself? You're muted as well. There we go.
Are we good?
Yes,
Can
thank
you.
you.
Hear me? Okay, great. Hi, I'm Jessica Farrell. I've lived in Delaware County for 32 years. I'm an artist and a member of NAMI, the National Alliance on Mental Illness. Also in 2017, I started a group called the Mental Health Justice Project with fellow advocates from NAMI. And I'm just very excited to be part of this, and I look forward to collaborating with the group, and thank you.
Great, thank you. Next is Erdem. I'm sorry if I'm pronouncing that incorrectly.
Hi, my name is Erdem Kahyoğlu. I'm a resident for about 15 years now up in Delaware County. I'm part of the Osmanlı Derga, which is a Sufi Muslim nonprofit organization. I think I was like the 7th person to move up here, and now I think we have a couple hundred members in Delaware County. We're a vibrant, growing community of diverse backgrounds. everyone from all faith backgrounds also, and new Americans. So I'm looking very forward to participating and offering any of our suggestions through the years that we've dealt with so many different types of people, and hopefully we can be an asset for this. Thank you.
Great, thank you. Next, I'd like to introduce Professor Simon Purdy. Thank you for joining.
Hi, yeah, my name is Simon Purdy. I am a assistant professor and program director of criminal justice at SUNY Delhi. I've been in my position here for just over 2 years now. Before that, my wife and our 2 kids and I, we lived in Michigan, and we moved here, and we love it. We absolutely love living in Delaware County. This work is actually really important to me. I've done work in the past on other with other agencies in the state of Michigan, as well as here in New York. I worked with the University Police Department over the past year to do a similar project, and I'm very excited to be working in this regard. I think this is an important work that this committee is doing, and I hope that I can help bring some research expertise to the table, as well as, I like to tell my students this, is that it's really hard to solve a problem unless you know what's going on and what's causing it. So I hope we can really work hard to identify those issues that may be going on in the community. So I'm excited to work with all of you, and thanks for having me.
Great, thank you. Next is Jason Craig.
Hi there. I was born and raised in Walton. I worked in public service for about 18 years for Cedarwood Environmental at the Village of Walton Wastewater Treatment Plant. I've also worked at the Andes Wastewater Treatment Plant for the Andes Water Department. For the past 15 years, I have volunteered on the Delaware County Fair Board, 5 of which I served as Fair Secretary. And as everyone else said, I appreciate the opportunity to participate in this, and I welcome everybody's opinions. Thanks.
Thank you. Next, Joyce, can we try again?
Can you hear me now?
Yes, we can hear you
Thank
now.
God.
Thank
There we
you.
go, God. Thank you. I'm Joyce St. George. I started my career a long time ago investigating corruption in the criminal justice system of New York City. I was the first female hired by the Attorney General to do so. And I did that for quite a while. After that, I started an organization that specialized in training police in crisis and conflict management, de-escalation, leadership, and a lot of related topics. I did that for about 30 years and worked with the federal, I forget their name, Human Relations Department when it existed, on race relation matters between police and communities of color after there has been after there had been a death. So I worked with several different cities and several different instances on really trying to get the police and the community to hear each other and to make some differences. I've been up here for about 40 years in the great town of Middletown, and was the chair of Margaretville Hospital. I now, my husband and I coordinate a food pantry, and we started a coalition on addiction that Mary and Cindy and Jen, many other people know about, trying to get expanded services down to the eastern part of Delaware County. And I have way more questions than we'll ever have time to answer, but I'm very eager to take this on. I think that one of the things that we have to look at is not so much the policies and procedures, but the culture. And that is not written in the mandate, but that is basically what most of these police reform committees are doing. And I'll pass it on.
Great, thank you. Next is John Hubbard, our District Attorney for Delaware County.
District Attorney for about 5 years now, at the end of my 5th year. I joined the DA's office in 2000. Before that, I was in a general practice in Stanford where I did some criminal defense work. I am on the adult treatment court for the county. So we deal with addiction issues and people who are dealing with those issues. I am on the police reform and review for the Village of Sydney, and I've seen what they've done, and I have some suggestions about maybe a survey we can put together. I'm looking forward to any ideas and suggestions we have going forward. I think some of our participants have isolated the mental health aspect as being important, of course, and deserving of more attention. I'm totally in agreement with that. But I look forward to working with you all.
Great, thank you, John. And I think we have one, is Dr. Samantha Cole on the call? Yes, Samantha. Dr. Cole.
Hi, yes, I'm here.
Oh, there you are. Thank you.
So yeah, I'm Samantha Cole. I'm a mental health specialist out of Unadilla, New York. I've been in practice for over 26 years, but 6 years here in this area. I definitely am excited about working with the community on this matter. I feel like it's important, especially for diversity's sake, people to be included and to have all sorts of different lenses in terms of how we view the problem and sort of different perspectives. So I really am happy to be a person that is a part of it. And also just with the emerging mental health concerns, which I've been a long time advocate for through COSAP. I really do feel that it is something that is interesting and that I look forward to being a part of. So.
Great, thank you very much. And next we have Mr. Keller, Walt Keller. Walt, can you hear us? And another minute, Walt, can you hear us, Mr. Keller? Okay, we'll come back to him. I believe that makes up the committee. Again, I want to thank you. What I envision this committee to be, especially after reading the first survey that we received and reviewed the answers, that I believe that we'll be really focusing on substance abuse and mental health issues. I am very, very fortunate to be able to work with Sheriff Dumont and his team. They're extremely professional. I think that they are very community involved. There's always room for improvement, and I think that that's what this committee can put together. What my role is to take the input from this committee and put it into a plan that I need to present to the Delaware County Board of Supervisors and have this passed by April 1st. So what I'm envisioning for you as all volunteer committee members is to get together. I wish that that we weren't in this COVID state, because I think that having an in-person meeting and being able to have what I think is a real conversation and to bounce things off and suggest things is a lot easier in person. But what I would like to do is have you all collaborate before our next meeting, come up with some suggestions on different issues that you feel that there could be some improvement on. You know, I'm would welcome any input from this committee. And if you are envisioning a different role for myself or for yourself, and I'll just open it up if there's anybody that wishes to chime in here.
If I may, I can.
Okay, Joyce?
So one of the interests I've had is in getting more community involvement and having a little bit more community input into policing in general, but the sheriff's office specifically, because that's what we are dealing with right now. So I think it's important that we know a little bit more about where we all stand. And my fear is that we're going to go off into these subcommittees, not knowing really where we are, and then come back and put together some what I would consider mishmash of ideas that may or may not overlap or be congruent. So one of the things that I've been hoping for, and I am sorry that I didn't make the first meeting, but one of the things that I am hoping for is to learn a little bit more about where this committee stands on the goals, on the interests. We're all talking about how, well, we can tweak this, we can possibly, there's always room for improvement, but I think that it would be really good for us to have a discussion on what is it that led us to be here, and what is it that each of us thinks we can contribute to that or should seek out. One of the things that I was talking to Sheriff Dumont about months ago is that, in a way, this is not about the Delaware Sheriff's Office. In a way, this is about policing and criminal justice. It's a national matter, and it's not something that we can look at and say, well, the Sheriff's Department didn't do this and the sheriff will get there. But I think ultimately what we're looking at is a national discussion on what kind of policing and criminal justice do we want? Do we have it? And if we do, that's wonderful. If we don't, where do we go from here? And I know that there's a lot of discussion about mental health and addiction. And that's one of the reasons that I'm here. I'm very interested in not having to force police to do jobs that they don't need to do, that they shouldn't be doing. The only reason that they're doing so much work in that area is because we don't have mental health and addiction services to the point that we need. So I just would like to hear more from this group about what do you want from this committee, and do you see holes? Do you see areas that we should be looking at? I can tell you I've got 17 questions right in front of me right now that I have just from thinking about this committee, that ranges from very, very, global concepts to very specific questions on practices. But I'd love to hear more from different people about what they want from this. I don't want this to just be a report that gets handed in. I will quit this committee if all we're going to do is write some report and leave it on a shelf. I've done that too many times. I'd like to see that this committee can start something that we can keep going with to support the sheriff's office and to make criminal justice and policing in this county something that we can be very, very proud of. So with that, that's my thought. That good, huh?
Can I piggyback off of Joyce for a second, please? So I agree with some of the things that Joyce is saying. I think that I know for me and for the people that I work with in this community, so when you have substance use disorder, it goes hand in hand with mental health issues, as I'm sure everybody is very well aware of. And I think that a very easy solution for us to start with and to work towards, and a very presentable solution, is to work on having a mental health peer on staff for the sheriff's office, as well as a coach for substance use disorder, and a domestic violence advocate. I think those are three very easy, attainable things that the sheriff can work towards, and would absolutely be a very, very useful tool for the people of our community, as well as our sheriff's office. And it's just a super easy way to get our community to feel heard and to feel supported. I know for me personally, when I was arrested, if I would have had a peer there, my situation probably would have been much different, because I would have understood better and I wouldn't have felt so scared maybe, and maybe the situation would have went completely different for me. Because once I was able to get into the jail and become an inmate, I was able to work with a coach, and it truly changed my outcome and my life. So from personal experience and professional experience, I think that these are very easy solutions that I think as a committee and a community we should work towards.
I think one of the problems we're going to have in this committee is finding problems where they don't exist. In my practice, I live to find police abuses. I love them. Unfortunately, I haven't been able to find them out of the sheriff's department. So as far as what I see going on in the news nationally, I'm not seeing the same thing in Delaware County. When I was in private practice, I worked in a number of different counties, probably 6 counties, quite a bit, where I did find patterns of police abuse at certain times and called it out. I can't say that that's true for this county. So where we may need help with the mental illness and drug addiction type of services, I think that's great, and we should work towards that. But I think we have to be careful not to try to make problems where there aren't any.
I was just going to jump in here. I don't know, can you hear me?
Yes, go ahead,
Yeah.
Jessica.
Okay, thank you. I just wanted to kind of elaborate on what Jen was saying earlier. Nice to meet you, by the way. With the Mental Health Justice Project, we've been working with some peers and really looking for answers for people with mental illness. And I really believe in the peer movement 100%. In fact, I made a book that I did a series of paintings and a book about peers, just because I was so inspired by the people I was working with. So in saying that, I mean, I see kind of a streamlined approach where possibly peers, you know, could be working in a crisis situation and kind of work with the sheriff's office. And I mean, ultimately, it would be wonderful if they could work with the state police, you know, the campus police, and throughout Delaware County. But I know we're limited in this endeavor. So I just see them, once they can connect with a person, they can then, you know, kind of have that person under their wing. And I will say, in anything in life, if you've experienced something, there's nothing stronger as far as a connection is to be with someone else who's had those same experiences. And I'm working right now through my project, the Mental Health Justice, and actually Walt is on that too, and he's also a member of NAMI, and I'm sorry that he wasn't able to connect because he's a fantastic member, and his motto, which is our motto for the group, is that mental illness is not a crime, and we all believe that 100%. So, I'm looking forward, hopefully, to getting peers involved because I really believe in it, and I'll send you all a link to this project I'm working on because it's really about the inspiration I had, and I have mental illness in my family, so I understand how difficult this is, and I think peers are the way to go. So thank you.
I would like to add that this directive is regarding the sheriff's department. It is about certain the village and the town police department. So from the county's perspective, this is, we may all agree that yes, there's a national issue with police departments, or you may not agree with that. But we've been tasked with looking at our own agency. And as Mr. Ormetti said, we shouldn't be looking for problems that don't exist. We sent out the survey, and I'm sure everybody has read the responses. The takeaways that I got from that were the mental health issues and drug addiction, but there were also several comments complimenting our sheriff's department and the way they participate and the training they have. I believe just in the accreditation that it far exceeds our local police department. So some of the complaints that I've gotten or emails that I've received from the community has been that this is a very rushed project. And I think that if we're trying to solve the national issues at a local level and have this done by April 1st, I don't think it's going to help us as county supervisors or the sheriff's department try to change anything that's really meaningful to us here locally.
Let me clarify, because I think that I might be misunderstood. I'm not saying that we're solving a national issue. What I'm saying is people look at police, whether it's the sheriff's office or the Delhi office or the whatever department, and at this point in time, there is a weight that has been added on the shoulders of police officers because of all the press they've received that's been negative. So whether we like it or not, that image is there. And that's the point that I'm making, is that we are part, or the sheriff's department is part of law enforcement in general, and that people will look at law enforcement today. And I am getting dozens of emails about this from people all around the county, that they're seeing things that may or may not even exist in the Delaware Sheriff's Office, but because the Sheriff's Office is part of law enforcement, people are putting that on them. So part of this is an opportunity to separate from what's going on nationally, to clarify what the Sheriff's Office is doing that is different from what other offices, other police departments are doing. So please don't take it that we're now solving the national issues. There, if there is no abuse, that's fine. If we aren't, reflecting George Floyd's situation, that's wonderful. But I don't think that we can just imagine that the many people in the community aren't putting the weight.
Yeah, I'd like to follow up on that, Joyce. One of the things that I'd like to get into here is I've heard from a few of you that that we might not have these problems at all. And it's entirely possible that we don't, but if we don't look for them and we don't kind of critically assess our institutions and our approach, how do we know if they exist or not, right? From the same survey where we were looking at, there were some that were, over some responses that were overwhelmingly positive, but there were also a few that pointed out that people felt like they'd been targeted because of their race or ethnicity. And it's possible that's an isolated incident, but it could be a larger pattern. So if we're not willing to, I think, readdress that from a research standpoint and go out and talk to people in perhaps a slightly more effective way, then I don't think we can uncover these issues. So I don't want to create problems that don't exist, but I also don't want to ignore problems that are under the surface that we haven't yet uncovered. So I think we have to be willing to look critically and try to uncover those if they do exist. And if they don't, that's fine. But if they do, we need to address them. And I think to kind of piggyback on what Joyce has been saying, I do agree that our committee, it's not to solve the world's problems. It might not even be to solve all of these problems, but it's to understand what they are, try to maybe understand where they're coming from, and offer some recommendations for what we could do. And then I think, as Sheriff Dumont mentioned, we can build on this in the future. This doesn't just have to be we pass something by April and then we're done with it. It could be a stepping stone in the right direction. So I think if we treat our committee in that regard and see this as a work in progress as opposed to we have to do everything by April 1st, we might have a slightly more productive approach to this.
I agree with that. Although we do have to have a plan that is presented to the board actually prior to April 1st so that we're in compliance.
Oh, absolutely. I don't want to be, out of compliance, but I also think that if we treat the plan as though it's the end all be all, we're probably going to end up disappointing ourselves and the community.
I'll just chime in here. I just want to say that in regard to the first survey that went out and some of the few criticisms that were there, they were mainly attributed to, again, the public's misunderstanding that I am somehow in control of the local police agencies and that Delaware County can control the local police agencies. I'm not going to mention the agency names here, but there were a number of agency names that were mentioned that obviously were not attributable to the Delaware County Sheriff's Office. I can tell you, as a publicly elected official, I'm out in the community all the time, and being a public official and being an elected representative, people have no problem telling me what's on their minds, believe me. And I like I said, I endeavor at maintaining transparency and openness all the time. I constantly out there. As a matter of fact, I have a meeting at a fire department tonight to discuss our relationships with the fire and EMS service. So I think I got a pretty good thumb on the pulse here. As Mr. Ormetti has said, we haven't had to the length of my recollection, we haven't had any racial issues here at the Delaware County Sheriff's Office whatsoever. But what I can tell you is what we do have is we do have a 300% increase in mental health calls. We do have a 250% increase in domestic violence situations. We have overdoses that are happening on a daily basis now. All right. These are the real concerns that, what the governor's intention was is to focus on what the concerns are for the local community, not for the state, not for the region, not for the country, but for our local community here in Delaware County. And they are really the true issues. And these are the issues that I would like to see the community focus on. I believe in the recovery coach model. I was one of the first jails in the state to implement a recovery coach program. And as Ms. Cutting has alluded to, it certainly appears to have benefited her very well. When it comes to dealing with some of these mental health situations that we have in the community, I think that there's lots of bridges that we can build to make things better. Because, if we keep repeating the same thing that we've repeated in the last, especially year, the results are not going to be good. So, suicides are up. I mean, and I've got deputies that are out there in the field every day that are dealing with these horrible situations, whether it be the suicides, whether it be the overdoses, the mental health issues, the domestic violence stuff. I mean, I'm having more in a day than I would have in a month, and I'm concerned about their mental well-being as well. As officers in the field being exposed to all these things. We've lost more police officers this year to suicide than we have in other deaths. That says something, so I think this is a trend that's important to focus on here. And I'm believe me, I'm open to any scrutiny. My door is open. It's always open. That's part of being a public official. You don't have a choice. But But
Craig, I think you bring up a really good point here about where we need to look and focus our efforts. I think it's not just asking the community what they need. It's also talking to your officers, talking to other folks in the criminal justice system to see what support they need from the community, right? And so I think part of this process we go through in whatever subcommittees we create, we need to be able to reach out to our community agencies and to your police department and maybe even other local departments to see, what support do you need from the sheriff's department, and also what could you help us with, right? And I think that would be a good way to approach building those community relationships.
Listen, I'm all about collaborating. I never profess to be the smartest guy in the room. I employ a model where I surround myself by the experts, and I'm hoping there's a whole bunch of experts on here that can help us with these issues. Thank you.
Well, I also think that there are models out there that we can draw from so that we're not feeling like we have to reinvent some wheels. I think that there's many small towns, many counties that are doing the same thing and may have come up with ideas that, maybe with a little bit of tweaking or whatever, might just fit our needs. So I think that the work, as much as, we could make it as arduous as you want, but I think that there's lots out there already that we can work with.
I agree with you, Joyce. I know that there's another sheriff's department that uses a model and it's been very successful. But Simon, I also agree with what you're saying. And I think that's a very interesting component because I never would have thought, but they are the frontline people, so to speak, dealing with our community. And I think, even the DA's office and public defenders and whatnot. And I think, they see a different side than possibly what I might see when I'm working with a client. And I think going to the deputies that are out in the community, I think that's a very valid point. And I think a subcommittee should be specifically talking with the people. One should be, in my opinion, one should be in about peer work and things like that. One should be working with the community and getting, reports back from the community. And then another one should definitely be talking to the people who are on the other side of it, as far as deputies, DAs, all that other, side that I don't really have any expertise in. So I think that that's actually a really valid and great idea. So thank you for that, Simon.
I think too, looking from the public's point of view, they really don't know what the policy and procedures are for all these departments. Sheriff Dumont sent me the policy and procedure manual, and I've done a lot of reading on it. And there are places in that policy and procedure manual that call for mental health to be called to the scene, and there is quite a bit in there. So I think a question that I would have is, what capacities do our current county agencies have? Do they have the tools to help the sheriff's office? Does the sheriff's office have what it needs to implement these policy and procedures? And I think that a good majority of the county residents don't actually know what's currently going on, so it's quite easy to point a finger.
This is my area. I would just tell you that there is a tremendous lack of resources in this county, one of it being a tremendous problem with workforce. We cannot find qualified mental health providers to come into the county. And so that's part of the issue. We do have a mobile crisis team that was designed after Bassett Hospital closed their crisis unit. However, that program has struggled with sustainability in regards to workforce. So I think this would also extend to peers too, is that you need to have a stable workforce before you can go forward. And then how do you pay for that workforce? Where are the resources for that? So those are the bottom line problems that I think we will have no matter what program or what kind of ideas we have to move forward.
And Cindy, just to add to that,
so there's like the peer movement, and it's a new movement. And I actually, through my employment in previous agencies and my personal connections, I know multiple peers, mental health peers, forensic peers, all types of peers that are around the county. And now, because the peer movement has become such a new hot topic, so to speak, there are plenty of grants that are able to be written specifically to employ peers. So there's always that avenue as well to look at to try and help with the area. But I totally understand what you're saying. And I feel like you guys have always been behind the 8 ball with that, because it's always been hard for you to get people to come to our county, mental health professionals, to work. And it has made us go back instead of forward, always. And I feel like it's been like that since I've been a member of the county. So, I mean, if we could possibly get some sort of mental health peer role, that might possibly help with having less actual people, mental health professionals in the office and whatnot.
RSS does have the capacity to hire mental health peers. They haven't been able to find some. So, it's finding that dedicated population that will sustain. The same thing with grants. I'm not opposed to grants, but what happens when the grants run out? So you develop programs based on grants and then they stop. So
you write more grants?
I'd like to comment, please. This is not a problem that is just in this area. We're the 4th poorest county in New York State. All rural, small counties have a problem with lack of funding, lack of resources, lack of attracting people to move here and to live here. So what I envision, one of the things that could come out of this committee is, and especially if there are a lot of other counties in the state, if they come up with the same thing that we're all experiencing, that, the squeaky wheel gets the grease, so they say. So if we all collaborate and have similar issues, then, maybe the state will listen. But I will tell you that at the county level, seeing what the last year has brought us, as far as grants and, I just don't see that as a solution right now. And again, it's not just in our police agencies or mental health, it's across the board. So, we can go off in a big tangent on different areas, but I just want to remind let's keep us focused on what right now this committee is tasked in doing, and is reviewing the policies of the Sheriff's Department to come up with solutions where that'll actually help the sheriff communicate better with our community. I don't think that, the whole funding and grant is an area that we need to really focus on.
But if I may, I do think that part of the issue I see is that we have to educate the public about the realities of what's going on. For instance, I know that one of Sheriff Dumont's, 2 of his deputies just witnessed suicides. I know that they're facing, the deputies are facing mental health crises they've never had to face before. And at the same time, I know that both Mary's organization and Cindy's organizations have had at least 20% of their budgets cut. And the expectation of the public is get mental health, get this, get that. They're looking at easy solutions. So I think that part of what we could be doing as a committee, it's not enough for Sheriff Dumont to go out there because, he's got credibility with some groups. He doesn't have credibility with other groups. And that's, again, it's not about him. It's about people who have these ideas. And I've faced them, ideas about criminal justice. I think that as a committee, we could look at how do we educate the public, or how does the public get educated about some of the issues that the police in Delaware County, specifically the Sheriff's Office, what they're facing these days and what it's doing. I mean, I look at recruitment as a big issue. I think that one of the things that I would like to see is an endeavor to find more diversity in recruitment through SUNY. I teach at SUNY, and there's a lot of criminal justice students who want jobs, who are people of color and are very smart. You know, I know I'm switching gears, but can we help the college students come forward? I know Sheriff Dumont offered my students to do a ride with and, you know, a visit, whatever. Nobody took them up on it. And I think there is just a gap between the police and students, even students of criminal justice. And it all comes back to how do we educate the community? And, you know, I just want to go back to what Jen was saying. I was a peer domestic violence and sexual assault counselor for 30 years and in the city. And I think that peer counseling, peer support, you know, those kinds of short-term interventions are fabulous. But there are people who need therapists, and they need the long-term therapy as well, especially with some of the multiple addictions that we're seeing today. So I think you need both. And I just think it's, I mean, poor Cindy Heaney, I've been yelling at her for how many years now about getting help. And she tries, but her therapist may handle something like 50 cases.
I'll try 100.
You be a therapist and try to handle 100 cases plus the reports. And I know she loses therapists all the time because they're not getting paid enough. They're doing too much work. It's just an impossible job. So how do we help mental health and addiction to build up their resources so that the police don't have to take on so much? And so I think the peers can be a help, but I think that there's got to be other solutions as well.
I would just like
I
to
might
add,
like to just say something if it's okay. Oh,
go ahead, Samantha, I'm sorry.
okay, thank you, Craig. I would just like to say that I can really appreciate hearing the different perspectives on, especially the mental health aspect, as this has been a pretty big passion of ours through COSAP. And I know I will say, even though some of these problems are on a huge scale, that they're probably not going to be able to be solved without, you know, a lot of work, probably even legislative changes. I think it's really productive today that we're kind of fleshing out some of the barriers, especially some of the obvious, more kind of in-your-face barriers, because these are barriers that typically circle us back around. And that's in my experience of working with different committees on changes that are needed. You hit these brick walls and there's really no way to get around it. And just speaking as a private practice counselor in this area that is not associated with an agency, I know that I've worked with Cindy in the past, and you know, Mary, all of us have kind of brushed, you know, together in terms of trying to bring about change. But private practice social workers also have a very unique plight that I haven't quite heard as addressed today. And I think that there's probably a willingness on behalf of many private practice social workers. However, there are a lot of barriers with being able to address our low-income communities and to be able to support them in getting mental health services by being able to use their health insurance. And so just to kind of throw that in the mix too, that is another huge barrier that we face in terms of private practice practitioners being able to fill a greater need rather than the poor agencies that are holding back the floodgates. But I think that the insurance laws really work strongly against private practice social workers or clinicians in that it makes it very impossible for people to be able to, utilize their health insurance and end up having to pay out-of-pocket money that they don't have for services. And I'm guessing too, even though I'm talking about this more on an individual level, this probably is on a bigger scale as well, in terms of being able to have, social workers be able to be paid for the services that they're doing. So again, kind of looking at the big picture, I really appreciate hearing everybody's perspectives on the barriers, even though we can't solve them today. It's good to kind of put that in the back of our minds to know what's really getting in the way. So this has been helpful for me too.
I would also just like to speak, going back to what Joyce said in regard to retention and recruitment, especially recruitment. I completely agree with her. It's something that we've been working on diligently for several years with the New York State Sheriff's Association, where I serve as an officer and on the executive and, more importantly, in my mind, the legislative committees. Civil service reform. Our hands are tied when it comes to recruiting police officers in New York State, because we're hogtied by the civil service system. And there's many a times when we're told that we have to, hire someone to fire them, and that's just ridiculous. They'll flunk us a psychological exam. Well, you got to hire them to fire them, or they have a terrible background investigation. You got to hire them to fire them. This is crazy. And they wonder why, some agencies have the problems that they do. I have a strict policy here at the sheriff's office. I hire smart, not fast. And if I have to leave 1-2 positions vacant for a year waiting for a new civil service exam to come out to get viable candidates, that's what I do, because I refuse to do it fast. I absolutely refuse to do it. It'll bite you in the long run. But what does that do? That taxes the deputies that are there. There's those 2 open positions that everyone else is making up for a year to 18 months before you can get to that next civil service list. So, we have been working on civil service reform with the New York State Sheriff's Association for several years. It's fell on deaf ears by the governor's office. And I really do think that I would like to see this to be a focus of the committee as well. I mean, there's a number of focuses, but when it comes to recruitment, civil service reform is a must, because we're absolutely tied to it. And that's not just us. That's every police agency in Delaware or in New York State.
Does anyone else wish to speak on this?
John?
Joyce, you're on.
I think John Grenier wants to say something, but he's muted.
There he goes.
Oh. Okay.
Hey, John.
All right, good. Sorry, my iPad's not working as fast as I wanted to. When we got this survey in, and there's a lot of good information in there, but I also looked at the fact that the sheriff department is doing a lot. And not to say that we're trying to put more on him, but there's a lot here. I mean, there's a lot. So here we are tasked by the executive order to go ahead and come up with some recommendation, some reviews, and some solutions. And it definitely has its place. That's something that we've been asked to do. We can't, I guess in my profession and what I do as a minister, have been a minister now for over 40 years, I can give all the information and education to people as much as I want. But if they're not willing to take that and apply it, then of course, there's nothing you can do. All you can do is just give it to them. And we understand that as each of us in the professions that we serve. But there's something that I sit on other committees. I sit on a press retreat committee of the New York State for the Assembly of God Churches. And we realized about 5 years ago, if we don't have healthy ministers or healthy pastors, we're just not going to have healthy churches. So I think also maybe our recommendation could be, we got to make sure those that are serving the community or serving the public from the sheriff's department, that they're healthy. Being a chaplain there for the past 15 years, I have seen a couple of the COs have committed suicide. When I was in the jail, I would make an effort to make sure I go around and touch them as much as I can. And what I mean by touch them is have a conversation with them. Though they see me as being there for the inmates and providing some type of a spiritual direction for them because of my profession. But I also understand that the whole man is just not spiritual. He's mental, he's physical, he's social, he's relational. It goes beyond of just what I do. And I know that. For the past 10 years, my wife and I, we opened a counseling center at our church here in Oneonta, and it's called Oneonta Counseling Center. It's free. We offer it free to the community for mental health issues. People can come in, people can, anonymity or confidentiality is kept the most it can. We are not funded. We are not on any insurance boards because of the fact that if we were, we could not offer the spiritual help that we're offering to clients that come in. My wife sees about 17 people on an average weekly about mental health issues. And getting those healthy are important because if you don't get them healthy, they're not going to be able to move on. And we realize that. They're not going to be productive. They're not going to be able to be the moms that they need to be or need to be workers that they need to be. So I recognize the healthy aspect. I don't know if that plays in this recommendation. I've always offered to Sheriff Dumont there. Hang on. I always offer to Sheriff Dumont the availability of our counseling center to any of the COs or any of the officers in the Sheriff's Department, because we don't have to report to nobody. We don't have to submit insurance claims. We're able to keep that anonymous anonymity there for them. And it has worked, and it has worked, and I believe it will continue to work. So I guess that's my aspect. If I can just throw that in there, we need healthy people in order to pass along those healthy things to other people as well. And I've like I said, I've been chaplain for 15 years. I can only allude to this because Jen alluded to it, but she was in my church services many times. I sat with her in the one-on-one counseling booth. And, but that's as far as my conversation could go. I could not do anything beyond the jail because of my limitations of the HIPAA laws and what I can do in the jail there. But yeah, I want to be able to help in any way we can. Culture, you are right, Joyce. Culture plays a very important role, impact upon society. And I see it. It happens every day. We're pretty good at putting masks up, aren't we? We're pretty good at putting that shield around us so we can protect ourselves. I know these sheriff officers as well as COs, sometimes they can't hide it. And the inmates see the vulnerability in it. And then on the inmates' part, if they know they're empowered, when they come in, they're like a rat cornered because they're empowered, saying, I know my rights, I know what I can do and what I can't do. We need to empower them, like Jen said, through a peer group. Maybe have a peer be with them before they go to the process of either being booked or something. Let the peer walk them through. Hey, listen, this is what's going to happen. Don't be afraid. This is a part of the process. Just go through the process. If the process is done right, just like quality control, things will come out all right. But you can't do the quality control after the product is done. You got to catch it before it's at the end. So those are my thoughts.
What I think that I'm looking for is before our next meeting, I would task everyone to review the police procedures that Craig has shared, review the survey, meet individually or in small groups, come up with some suggestions, some areas that you think that we can work on. Have something prepared that you can submit to the entire committee so that we can focus on what we think are issues that affect our own agency, the Sheriff's Department. And again, I don't think that anyone is disagreeing with a lot of these issues that are on the national level, but we really need to focus on what's happening here in the county. And I'm open to suggestions if you'd like it to do it a different way. I need input from you on what to put in this plan that affects our Sheriff's Department.
I'm just going to add to that. It's very important to me that we get something that we can use, that we can actually tangibly use. And I'm all ears and I'm all open to any idea or program that we could feasibly pull off, because we need the help. I mean, I've said it, I've talked to the papers recently. When it comes to mental health and drug abuse, we need the help. It's getting very, very bad out there. As far as the national race relations and stuff like that that are happening in the news, I'm going to be very frank with you. I'm not seeing those problems with our sheriff's office. What we did when we saw those issues, we were proactive. We went out there. We made contact with our minority communities in Delaware County. I went out, and I'm sure Erdem can speak to this. We made friends with probably the areas that contain their most minority population. Erdem's community in Sydney Center, as well as the MO in Hancock. We went there, we visited, we sat down, we broke bread at the table, and we listened to them, and we've helped them with some injustices that they've received from the local community. So I stand behind. I think that our sheriff's office has been very proactive, looking at the national scene and making sure that we are doing the things that we should do in regard to building those bridges. And I'll let Erdem speak to that, but I really think what I need is I really need some help with these other issues with mental health, with substance abuse, predominantly.
Because those are the issues that are affecting us.
Yeah, and I think there's an interrelationship between all of these issues, right? You know, if we're talking, we've mentioned here today that we have, you know, high rates of poverty, right? That's a big issue. Now, I don't think this committee is going to be able to solve poverty, but I do think if we can help to address that or make sure we attach that as kind of one of the root causes that's underlying not just the issues here, but, you know, we see this nationally as well with crime issues, et cetera. If we can recognize that we do have some of these underlying issues and we can try to understand where they're coming from and what we need to do, I think we're to be able to create some actual decent suggestions for fixing things. I do want to mention to you, you had mentioned kind of subcommittee work. And I don't know if we're necessarily ready to break out into subcommittees at the moment, but I was just, from our conversations here today, I've been kind of typing down some ideas for potential subcommittee topics. One of them could be something like community partnerships. So a group that might look out to see, you know, what do our community organizations need? What could they offer? We need an outreach group, maybe. Joyce was talking about with public education, with reaching out and sharing not only what the community is doing, but also, you know, educating the community on recommendations. I think we should do something with research. I know the survey that was put out earlier, it's a good start, but I think we could follow that up with something a little bit more comprehensive now that we kind of have a rough understanding of what's going on out there, as well as talking to our law enforcement officers to make sure that we can get them the support that they need, see if there's any issues going on there with those types of things. Obviously, policy and procedure. That's one where, you know, we've talked about that all along. So, you know, we obviously all need to look at it, but maybe we could have a specific subcommittee subcommittee that could sit down and pour through that and then take the recommendations from these other groups and say, hey, here's the stuff we need. And then maybe a group on resources, right? So this has been kind of an underlying thread to a lot of our conversation here today, where, you know, we're talking about what resources do we need by the community and by the sheriff's department, and what are the gaps in finding those resources, and maybe also looking to our sister and partner communities around here to see, and counties to see if they're having similar struggles, or maybe they found some unique solutions as well. Those are the I guess 5 that I was able to pull out. But if anyone else has ideas for maybe groups we could start to consolidate around, I think we should maybe do that before the next meeting.
And Simon, would you like to head that up?
Head what up?
Head up the committees?
Organizing the committees, I can certainly help with that, sure.
Okay, that'd be wonderful.
Joyce, you're on mute, but you got your hand up.
All right. I would also add something just to Sheriff Dumont's point and Samantha's point before on governmental relations, because it sounds to me like, or legislation, something about how the sheriff's office is stymied in terms of hiring practices and things of that nature, and private social workers are being stymied because of insurance. And I'm just wondering if we couldn't get somebody from Albany to talk to and see what can go on. If the Sheriff's Association hasn't been able to do something on civil service, maybe there's some other avenues that we can pursue. That could go under resources, but I think that it needs some identification. Because when it comes down to it, I think you're absolutely right in so many ways that, you know, it's a government entity, the sheriff's office, and they have to abide by whatever the rules are. And so they could have their hands tied.
We do all have our hands tied.
Well, or cuffed. I would really be happy to work with the officers. I would love to do that part and, you know, see what they're up to. You know, see what their input would be. I think there are many. I'm sorry.
Joyce, I think our form of communication, we all have our email addresses, and I think it would be helpful if we all knew what, you know, if there's a committee forming or who's going to take on certain jobs. And I believe we can certainly do that through the email system.
Okay.
I was just putting together a little sign-up sheet that I'll send around after the meeting with all the different kind of topics for committees, and then everyone can put their name next to the one they'd most like to serve on, and then maybe your email too, so we can at least, you know, anyone can go in there, copy the emails for their subcommittee and go.
Great.
And Simon, if you need any assistance, please feel free. I will gladly help you get everything situated.
I will take you up on that, Jen.
Task.
Thank you. I'll take you up on that.
Absolutely.
So could we plan for the next meeting? And I suspect it'll be over Zoom, Tuesday, January 18th at 11, to come back with some concrete suggestions or solutions or things that you would like to see our sheriff's department focus on, that, you know, that'll help our community.
The 18th is a Monday. Did you mean Monday or
I'm
Tuesday?
sorry. Yeah, it's January 18th at 11.
That works perfectly fine with me.
Is everybody in agreement with that?
Yeah, I think Jessica Farrell wants to say something.
Me too.
Where'd she go? Okay.
Seem to be muted.
You're on. I can hear you now.
Okay, good. So I work with a group of advocates, and some of them are in Albany. You know, some are in Syracuse. They're all tied in with mental health, and they come into our meetings in Oneonta, which is where we've been holding our meetings. So I would gladly disseminate material to them. They might help with resources from the Office of Mental Health. It's a great group of enthused advocates that would certainly be willing to help in research or anything and lighten the load, because this is a huge issue, mental health in Delaware County and all over this nation. I think what really, just the statistics that the sheriff has said, this is something we have to tackle, but resources will be the issue. So I'll do what I can with my advocates. I just wanted to put that out there.
What I think is really great about this committee that we've put together is I think it really it is such a diverse group. We have people that have experience, we have professionals, we have people in the law area. I think that we have a really diverse group that you could go off into your own subcommittees and touch base with the people that you're connected with to come back with some ideas and some suggestions on, what can we do better?
I agree.
Can I just comment on something that's a little bit more housekeeping related?
Sure, Jess.
Okay, I'll start my video. Okay, so just remember that when you have a committee meeting, if you could send minutes to me or Amber, that way we can get them posted on the group. The group is on Facebook, and that's going to be the best way to communicate what the committee's doing. So when your subcommittees or when you have lists of committees ready, just remember to keep Amber and I in the loop so that we can get these things posted. We're right now getting the website. We're getting a section of the website for Delaware County, so we can house all of these documents as well. So, and if you do a Zoom meeting, just record it and send me the MP4, and I can post that. And that way we keep the community in the loop with everything that's happening.
So that would be a separate website, Jessica?
Well, no, we're working with IT right now at Delaware County so that they can post documents. But the group that's on Facebook is a wonderful place where everything is also going to go, and we share widely around the county from there. And where press releases are going out, when there's enough stuff that's happening with the committee, we'll send out another press release. And Amber, I don't know if you have anything to add. The more information you can get us, the more information goes out to the community. So
the one thing, Jessica, if I may, the one thing I've been hearing is some people, believe it or not, are not on Facebook.
Well, the libraries have computers with Facebook, and, I'm not quite sure how we can, make that better. Video would never have been available before Facebook. I don't know how we could have gotten video somewhere before Facebook was available. If you have any suggestions, let me know. If they're feasible, we'll get them out there.
I'm just wondering if, does the county have a website that we could link into?
Well, yeah, that's what we're getting set up now.
Okay,
It's just, it doesn't happen overnight, it's unfortunately, we've been working on that.
As long as I communicate that.
Yeah, it's just, the videos and the stuff we have recorded, that is that's a function of social media. We would not have had access to that prior to social media. So maybe people have friends or people in their family that can help them get on. It's very easy to find stuff on the social media channels.
Plus, this is being streamed live on YouTube, which all you need is an internet connection to get onto YouTube. So that knocks the Facebook component out. Anyone can get on YouTube, whether you have an account or not.
Maybe not us grandparents, but maybe you could ask your grandchildren on how to operate it.
And if
Okay,
anyone
I asked my kid for help too.
If anyone has any
YouTube as well, Jessica?
This is streaming on YouTube right now, and Delaware County, New York has a YouTube channel where we post all material that is video recorded for the county. So anything can be found there on the Delaware County New York Facebook page. But what we do is we share to other pertinent pages and to groups that people belong to around the county. And, you know, when we look at the numbers, we're reaching thousands of people. So unfortunately, that is the main mode of outreach. If anyone has any suggestions for getting outreach to specific communities that just cannot get this material, please let us know and we'll get on it.
Okay, cool.
Are there any questions? Does anyone else want to comment?
I just had a question for Jessica. Jessica, you mentioned that this was live streaming right now. Was that something we could start broadcasting, you know, out on, say, social media platforms or things like that before meetings? I've had a few emails from folks who found out I was on the committee who've wondered about that, and I didn't have any good answer for them.
I don't understand what you mean.
Meeting. So, like, you say it's live streaming right now. So, like, would anyone who had the link be able to watch it live?
Yeah.
Or are you just recording? Yeah. So maybe we could start putting this out prior to our meetings. You know.
Well, we don't get a link. We don't get a link until we go live. So
gotcha.
Yeah. I mean, that's just not possible.
Or maybe we could give them a page that they could go to find the link as soon as
we do.
Yeah.
The community group, which you are all linked to, and please share it to your communities. I don't know how else to get it out to your people. You have to share the link to the group and ask people to join it, or ask them to like the government page, because that's where the information is emanating from. And, you know, we've sent emails asking everyone to do that, and we can't stress the importance of it, because otherwise people don't know where to go. You gotta clue people in. And the other thing is, I'm recording this meeting right now, and we'll get it up as soon as possible. And that will be emanating from the government page, shared to the collaboration group, and then shared to as many other groups and resources as we have. And, you know, we hope you will all share it as well.
Thank you.
Yeah, some people are also, I recommend that they subscribe to the Delaware County, New York YouTube channel, and make sure that notifications are turned on for YouTube, and then we'll get a notification when we go live like this.
We're trying to be as transparent as possible. And actually, I think COVID has made it a more transparent process, because we are, you know, putting this all on the websites and the Facebook. So does anybody have any questions or unclear of what we're looking for to come back to the next meeting? Okay, again, I really want to thank you all. I know that we definitely have our work cut out for us. But if we do this, we'll find out, you know, if we think that there are issues that can be improved. So thank you very much. Merry Christmas. If you need anything, please reach out to me. Okay.
Thank you very much, everybody. Happy holidays.
Thank you.
Take care, everyone. Be well. Be safe.
You too.